Thank you very much, Benson. An amazing character, Mr. Benson Chen.
Thank you so much, Graham, and thank you to MS Taranaki for the opportunity to speak this afternoon. I'll just pull up my little slide thing here since I can't actually see what I'm talking about, but let's have a look what we've got on the slides. Perfect. So, I think I'll start off by saying that visual issues are really common in multiple sclerosis. So often when we think about visual issues in MS, often, we think about optic neuritis. And even if you haven't been given a diagnosis of optic neuritis, people with MS experience visual symptoms, and they're really common. So this is a study that I always come back to because this is a study of 496 people living with multiple sclerosis in the Netherlands, and they completed a survey asking them about visual symptoms and visual complaints in general. And what's really fascinating with this particular study was that 90% of respondents had at least one visual complaint, and almost a quarter of people had at least 10 visual complaints. And so what are the sorts of visual complaints that people can experience? The sort of common things are things like, trouble focusing, trouble with sort of being affected by glare or light sensitivity, issues with light and dark adaptation, needing more time to, focus their vision. Depth perceptions are a really common one. But what was really interesting about this particular study was that of the 496 people that were involved, only 103 actually had optic neuritis. So that comes to the next question, well, why do we get visual symptoms in MS? But to really answer that, we first need to think about how do we see. So the analogy that I like to use is to think about the eye as basically a camera. And I know most of the audience now probably just use their cell phone to take photographs like I do, but are there any photography fanatics in the audience? No. Okay, so yes, good. So I hope you'll appreciate this analogy, okay? So the eye basically works the same as a camera. We want light to pass through an aperture, so, a little hole, in which case in the eye it's the pupil, and the purpose of the machinery of the eye is to get that light onto the retina. And the way that it does that is it uses the lens at the front of the eye to focus light onto the film, where the image is captured. So if you run into trouble with the camera, you can have, problems with the aperture. So if the pupil's too small, not enough light gets in, you can get, poor quality image. If you've got issues at the front of the camera, like, a bit of glare or ocular surface problems, you can get sort of, very blurry, fuzzy images like the middle thing that we see there. And also at the same time, if you have issues with the lens and the light isn't able to focus properly at the back of the eye, the vision gets distorted and out of focus. But the camera isn't really just all that we need for vision. In order to sort of process that information that's coming in, the brain is the one that ultimately does the looking. So even though the eyes do the seeing, it's the brain that really processes that information and makes sense of it and helps us decide what we need to do. And the optic nerve, the thing that's usually involved with optic neuritis, is basically the electrical cable that connects the camera to the computer. So we can see that there, over here, and the camera's the brain. So what happens to the brain once that light information gets sent? So most of the processing actually happens at the back of the brain in the occipital visual cortex, or the primary visual cortex, and information basically comes in as little pixels, and the brain then divides it up into information about where that light is located in space, what color it is, and then from there we've got two separate pathways that decide, what the lines and dots and shapes represent to give us object recognition, or even, making shapes out of faces and things like that from the fruit that you can see there. But also the other pathway that's really important is guiding actions related to vision and recognizing where objects are located in space. But we've got two eyes, right? So we obviously use both of our eyes, and the power of having two eyes is that the area that we see, the visual field, not only is it just that one eye, but now we've got this wider area, so a lot more richer visual information, but we can also do things like understand depth. But in order to do that, we've also got to have machinery in the brain to move our eyes to work together. Otherwise, we end up seeing double vision. So I'm not going to go through this next slide because this is all horribly complicated, but this is just to indicate that there's a lot of pathways that are involved for processing visual information, but also getting our eyes into the right spot in order to get that light information into the brain. And so the really important part of the brain that helps us coordinate our eye movements is here in the brainstem. But we can say that over 50% of the brain is involved in vision. So let's come back and talk about optic neuritis, since it's the most common presentation of visual symptoms in MS. So here's a classic case. So we've got a 23-year-old woman who developed a blurred spot in her vision in her right eye on a Sunday morning. By Sunday night, the fuzzy spot had grown bigger. And then she also noticed some discomfort around and behind the eye, which she described like a pressure feeling, which felt worse when she moved her eyes. So maybe it was because she was staring at her phone the whole day. Maybe it was because she was tired. And she tried to think of other reasons that might explain for her visual symptoms. Unfortunately, the next day, the spot was very blurry and she couldn't read clearly at work, and the pain was still there, so she decided to stop by Specsavers on a lunch break, and this is kind of what she was experiencing. So the optometrist at Specsavers saw her and was concerned that she had optic neuritis, so she was referred to the eye clinic. And at the eye clinic, we did a bunch of tests. We looked at her visual acuity, so I asked her to read off some charts and noticed that the vision in her right eye had gone down to 624. Remember, 6/6 or 20/20 vision is sort of perfect vision. So she had reduced vision in that eye. She also had reduced color vision, and her pupils weren't reacting as well in that right eye too. And so when we checked her visual field, so the area that she could see in her vision, we noticed that she had a big spot or a scotoma in the center of her vision. She was then diagnosed with optic neuritis, and the ophthalmology team discussed treatment with her, and she decided to go ahead and have steroids, and her vision improved a little bit after the first dose. By day 3, her vision was much better, and the ophthalmology team were happy to discharge her home with some oral steroids for another 11 days. She then went on to have an outpatient MRI, and that was arranged about a month later. By now, her vision was 95% back to normal, and a week after her MRI was performed, she got a phone call from ophthalmologists telling her that they had referred her to neurology for review. And when she was seen by neurology 6 weeks after that, she was advised that the scan showed some demyelinating lesions and she likely had MS. So the reason why I bring up this case is this is quite a common sort of, presentation, and I'm sure some of you in the audience may have experienced this yourself. And the reason why, we often end up seeing patients in the neurology clinic after optic neuritis is that optic neuritis is a very common cause of first presentation of MS, but also in the historical days when we didn't have access to excellent disease-modifying therapies, 70% of people with MS would experience an attack of optic neuritis at some point in their disease journey. So a quick look at the optic nerves. So the optic nerves is my favorite part of the brain, and it's this bit. I won't push anything in case I actually will see. No, so no pointer, but the optic nerves are these bits. We've got a little pointer there, perfect. So the optic nerves are essentially the little cables, the bit that connects the eyeball to the brain. And the analogy I often give to my patients is if you think about horror movies where the zombie's eye kind of drops out and there's that stringy thing, that's the optic nerve. And the optic nerve itself is really interesting because it's basically the same tissue as brain, even though we use the analogy that it's an electrical cable and it's wires that connect the eyeball to the brain. In itself, the optic nerve is the exact same tissue as brain. So what happens with optic neuritis? So with optic neuritis here, we've got our little cartoon character. If you get inflammation of the optic nerves due to sort of activation of the immune system, That basically leads to the symptoms, which is here, as you can see, with the central part of the vision that's blurred. So often optic neuritis is represented by the central blurring of the vision, but what we do understand from lots of studies is that it's not necessarily just the central part of the vision. For some people, it might just be the edge of the vision or the side of the vision, but usually it's associated with pain with eye movements and other impairments such as a reduction in color vision, but also loss of clarity of vision as well. So optic neuritis, it's not necessarily a term that's specific to multiple sclerosis, but essentially it's a disease process caused by inflammation of the optic nerve leading to vision loss and pain. So how do we diagnose optic neuritis? So traditionally, the diagnosis of optic neuritis is really relied on clinical symptoms. So a doctor would listen to a patient tell us the story of their vision loss. We might check for things like visual acuity, so the clarity of the vision. We might look inside the back of the eyes and notice that there may be some inflammation of the optic nerve. But nowadays, the main way of diagnosing optic neuritis, and particularly diagnosing it accurately, is using an MRI scan. And you can see here on the MRI scan, this little white arrow is just pointing to an enlargement or thickening of the optic nerve where the optic nerve has become inflamed. And the reason why I bring this up is because optic neuritis is a diagnosis that's often made in excess. So in other words, doctors who don't necessarily have access to MRI or who aren't sort of keeping up to date with the new diagnostic criteria might just make a diagnosis of optic neuritis, which then can lead on to sort of unintended consequences as well, particularly if you get an MRI scan which shows some non-specific dots and we don't know whether or not they represent demyelination or multiple sclerosis. So let's talk about the treatment of optic neuritis. So there has been clinical trials that have been done which show that treatment with 3 days of intravenous methylprednisolone, so high-dose steroids, speeds up recovery by about 2 weeks, but it doesn't actually improve or doesn't actually affect the ultimate visual recovery. So in other words, if I cloned myself and my clone both had attacks of optic neuritis and, you treated me, you didn't treat my clone, my visual recovery in 2 weeks' time will be better than my clone, but if you examine both of us in 3 months' time, both of us will have the exact same vision. So one of the fallacies that we see in the in the neuro-ophthalmology clinic or even in the eye clinic is that people obviously want to do something and want to treat. But if you have just a simple attack of optic neuritis, actually if the vision loss isn't that significant, there may not necessarily be any need to give steroids. You can actually just wait for the vision to recover. So visual function usually recovers within the first 2 weeks, and most of the recovery happens by the end of the first month, and there may be some further slow recovery after that, even without treatment. So what about visual prognosis? So after optic neuritis, visual prognosis is generally really good. The severity of vision loss when you present at the time of the attack correlates with your visual recovery, but that doesn't necessarily mean that vision stays perfect after optic neuritis. Common problems after optic neuritis includes things like problems with glare and light sensitivity. So standing here at the front of the stage with the light shone on me, if it's really uncomfortable, that could be a symptom, or even sort of, at night time when you're driving and you've got headlights, from the oncoming cars sort of dazzling or blinding your vision, that can be quite a common symptom after optic neuritis as well. The much more common sort of problem after optic neuritis is problems with contrast sensitivity. And I think the projector there displays it perfectly because hidden in that white box on the right side of your screen, if you've got really good vision, you can probably see that in grey lettering, the letters MS are in there. But if you've got poor contrast sensitivity, it's very difficult to tell, very light shades of grey on a white background. The other issue that can happen is colour desaturation, and I think this displays it quite nicely. So colours aren't as vibrant or bright or contrasting after optic neuritis. And certainly the other thing that's really common is fluctuations in visual function. So depending on how you're feeling, depending on the presence of other illnesses, body temperature, fatigue, and all those sorts of things, vision can fluctuate as well. That doesn't necessarily mean to say that you're having another attack of optic neuritis, but it's just a sign that the injured optic nerve isn't functioning as efficiently as it should be. And the other point there is that people often notice that they may have difficulty with fine detail or blur in their vision as well. What are the other common things that can happen with multiple sclerosis is abnormal eye movements. So I won't go into too much detail, but we've got a little video here of someone with a condition called internuclear ophthalmoplegia. So what this basically means here is when you can see the chap looking to his left or to the right of the screen, you can see that the eyes basically, instead of both moving to one side, one eye basically moves and the other one doesn't. So the eyes become split up. And as you can imagine, this can be quite debilitating, particularly if you're doing lots of activities where you need to move your eyes from side to side and you're experiencing double vision. So the eyes have to be aligned whichever way, whichever direction we look if we want to have nice, clear, straight vision. The other thing that can happen is so some shaking of the eyes. So this is what we call nystagmus. And both the internuclear ophthalmoplegia, the eye node that we saw from the last video, as well as the nystagmus that we see here, typically occur when you have MS demyelinating plaques involving the brainstem as well. So you can imagine if your eyes aren't being kept still and you've got this constant shaking or shivering of the eyes, this can basically lead to blurring of vision as well. So here are some of the visual symptoms of MS, but hopefully I've convinced you that some are actually related to MS lesions, other things are related to the eye, but also some sort of visual issues can be related to treatment effects, and I won't go into that at all. So the main point I really want to make here is that although optic neuritis is a common symptom of MS, not all visual problems in MS are due to optic neuritis. So some general management advice. So I think it's really important because people can still develop other eye issues, even if you have multiple sclerosis, to make sure you have your annual eye exam with your optometrist looking for really common problems such as dry eyes, raised pressure in the eyes, or even cataracts as well. Really important to also have updated glasses, and my usual preference for my patients is to have separate glasses for distance and separate glasses for reading. Although we like the convenience of bifocals, the problem is if you've got a step in the glasses, that can potentially also impact mobility and balance and increase risk of falls. Because glare and light sensitivity are quite common after optic neuritis, also having special sunglasses or filtered glasses can be really useful as well. And the other strategy is for those of us who like to use our computers, tablets and phones, look up the accessibility functions and turn on the blue light filter or use night mode as well to prevent sort of ocular discomfort and other visual symptoms. We're nearly there. So the other thing is to think about contrast vision as well. So on the picture on the left, if you can see it, I can't see it even when I'm up here, there's apparently a white little Westie dog in the snow somewhere. But on the right side of the screen, you can see the black coated dog there. So contrast vision is really important, and like that thing that I showed you before, if you can see it inside the box there, it actually says low contrast small font, but here you can see high contrast large font as well. Okay, so using adaptations and looking at things that can help with reading can really have an impact on vision related quality of life, because we use our eyes for so many aspects of our life. It's not just seeing things, but also social interactions, recognizing faces, the jobs that we have to do, the things that give us enjoyment in life. The final thing to mention is also pseudo-relapses in after optic neuritis are really common, and they can usually last hours to days. So you may get temporary worsening of vision, which might be related to infection, stress, and fatigue. And I think I'm out of time, so we'll just flick past all of this. But this is to say that in terms of the research sphere, we're now sort of recognizing the eyes as a window to the brain, and there's lots of measures that we can use to potentially track MS disease activity activity, including MS disease progression as well. And one of the really interesting areas is using the optic nerve and actually measuring the thickness of the nerve fibers that are there. So if you think about the analogy of those wires and those wires being injured, we can actually measure the thickness of those wires and the volume of those wires and track what happens over time. But what's really interesting is that even if you are a person, even if you are someone who has multiple sclerosis, who hasn't had optic neuritis, MS plaques, which involve the visual pathways behind the eyes and in the brain, they can also lead to thinning of those wires in the front of the eye, and we can actually measure those there like this. So you can see at the top panel, the green is sort of lots of healthy nerve fibers, and gradually over time, it becomes all red when people lose those wires at the back of the eye as well. So in summary, there are many neural pathways involved in vision. MS can present with optic neuritis, diplopia, double vision, and shaking of vision as well. Visual symptoms are really common. And managing visual symptoms includes a number of things. So it's not only about optimizing MS sort of treatments, but also thinking about ocular health and eye health in general as well. And I'll finish there.